Hello, and welcome to Joint Replacement class, How to Prepare for Your Joint Replacement Surgery. My name is Janet Dyroff. I'm a nurse patient educator here in the Joint Replacement Center at Maine Medical. Thank you for choosing Maine Medical for your upcoming surgery. We do over 1,700 total joint replacement surgeries each year, performing state-of-the-art procedures that are leading to faster recovery. Our class goals today are to answer as many of your questions as possible, present the information in a language that's easy to understand, encourage you to call if you have any further questions, and review the steps you will need to know for your surgery. So what can you do to be ready for surgery? First, you can review the patient education guide, which is in the burgundy folder given to you by your surgeon's office. Make sure that you review and save your appointment sheet from your surgeon's office as well. And if you have any changes to any of those appointments, please call the Maine Medical Partners number at 207-781-1551. And there's more. Make sure that you stay as active as possible between now and your surgery date. Exercise if you've been given instructions to do so by your surgery. Eat and drink healthy food and liquids, and if you're going to have a flu vaccine, you're encouraged to have that at least 3 weeks before your surgery. Make sure you limit or quit smoking and that you keep any diabetes under control working with your primary care physician or your specialty physician. And then remain informed and ask as many questions as is necessary. What else can you do? Make sure that if you've been asked to have any medical clearances by your surgeon's office, that you get those completed before you return to his office for your history and physical appointment. When you're at that history and physical appointment, discuss any medication orders that you're given and follow those instructions about any medication changes before surgery. And last, make sure you've checked with your insurance provider regarding any coverage you might have or your needs for equipment and prescriptions. It's recommended and you will need to have a front-wheeled walker with you on the day that you check in. So try to borrow one from someone close to your own height when possible. Walkers are adjustable to a point. Rehabilitation therapy will help adjust it further once you've arrived. Wheels can be purchased for the front um, legs if necessary, so just know that that's a possibility. And when you go home, you'll also need to have a cane, so again, you may purchase that or borrow it. But this will need to come with you the morning of surgery. Home preparation. It's a good idea to start arranging for help at home. Someone to stay overnight for a few days, someone who can help you with light errands. They also can help with preparing meals in advance, and anything you're able to do at home before your surgery will greatly reduce your anxiety. We also encourage you to do a safety check of your home. Look to remove scattered rugs, any sort of electrical cords, either tape them down or have them removed. Organize your bathroom and kitchen so your objects that you might need are in easy reach. You can formulate or make yourself a tool belt for carrying portable or cell phones, covered cups, and those types of things, because we do want your hands to stay on the railings of your walker. And then try to set up a recovery area of your home, someplace where you can relax, get your hip or your leg elevated slightly, and someplace you can be comfortable. Things to bring to the hospital. You will need to bring that front-wheeled walker with you. If you have sleep apnea and you use a CPAP machine, please bring it with you as well. Any personal toiletries, including glasses, hearing aids, and dentures. Loose-fitting, comfortable clothes. Um, Anything for shoes, just make sure that you have closed-toed shoes. And then remember to bring your insurance card and a photo ID. The night before surgery, make sure you have nothing to eat after midnight, including gum or mints. After midnight, you may be allowed to have clear liquids as directed by your preoperative provider, but they will be very specific about the time they would like you to stop those liquids. Make sure you wash with your Hibiclens soap, which is given to you in the surgeon's office, and make sure you do not shave, use any hair removal products, or mark the surgical area. So when I say don't shave, that means don't shave your hip and don't shave near your knees. Um, don't use any hair removal products on those areas as well. On the day of surgery, please shower again as directed with your Hibiclens soap. Take any medications that you've been directed to take with a sip of water only, and please arrive at the main medical center admitting office at the scheduled time, which is directly off the main lobby of the hospital. And finally, on the day of surgery, please do not bring any of your other medications to the hospital unless specifically directed to do so by your preoperative provider. You will then, once you've checked in through admitting, you will be escorted to Surgery 2, which is located on the second floor of the L.L. Bean wing of the hospital. 2 friends or family, whoever you choose, may go with you into the preoperative surgical area. The nursing staff in our PACU, our pre and post anesthesia care unit, will help you get ready. They make sure that you have a list of any medications that you've taken the morning of your procedure, and also the day and time of any other of your medications that you take as well. You'll meet briefly with anesthesia and your surgeon before going back to surgery so you can answer any last-minute questions. And your surgery will take somewhere between 1 and 3 hours. Every surgery and every person is slightly different, and your surgeon will advise you. After your surgery, you will wake up in the recovery area. Again, recovery can take anywhere from 1 to 3 hours depending on you. You will be attached to equipment to monitor your heart rate. You may have oxygen, like an oxygen mask on your face as you're starting to wake up. It's there to help you. You will also have IV for not only fluids, but antibiotics and pain management. You may have a drain coming from your incision. It will be a clear tube that's attached to a larger container. You may see some red liquid in there. That's a good thing. We want it to do that. It's taking off additional fluids, and that will be removed early the next morning. Then your incision, you will also see that your incision will be covered. You'll have a large dressing or a compression dressing there, and but again, that will all be monitored by the nursing staff. You will be able to have visitors as soon as your nurse feels that you're awake, comfortable, and alert. Postoperative comfort management. You may have some discomfort after your surgery. Our goal is to help you keep as comfortable and your level as tolerable as possible. We teach you to describe your comfort level using a 0 to 10 scale. You will set a goal based on that 0 to 10 scale that's acceptable to you. 0 equals no discomfort, and 10 is being the most discomfort that you've ever experienced. Patients often find that a 3 to 5 comfort level is acceptable to them. Each of you will have a different level of acceptance, and we will use your personal comfort goal as a guide. As soon as you are comfortable, awake, and ready to be moved off to the inpatient care unit, your nurse will be there to greet you. You may initially be drowsy. We will make sure that your family follows you into your inpatient unit. You will still have your IV. That will be discontinued after you're drinking enough fluids, and we will encourage you to eat a light meal as soon as you are able. Your comfort is very important to us, and we continue to progress with that. You will need to be able to do exercises, so it's important that we keep you comfortable and you'll be able to heal better. So in the first 24 hours, we will help you transition to medication by mouth. You will need to ask for medication when you feel that it's necessary. It's also important that you take medication 30 to 45 minutes before you're scheduled to meet with your physical or occupational therapist. It will help you be comfortable and be ready to do exercises. Please ask for help from the staff when you do get out of bed, so please make sure that you always have either a nurse or a physical therapist or a nursing assistant available, and not ask your family to assist you. We want you to be safe while you're here. What else should you expect? Patients may need to wear compression stockings on their legs. They help with circulation and prevent blood clots. Please wear them as instructed. Usually you wear them during the daytime, remove them in the evening, wash them out, and then put them back on the next day. Risk prevention, so walking will help prevent blood clots. You will receive IV antibiotics for the first 24 hours. Hand washing should be done by everyone entering your room, whether it's staff or family visiting. Please remember, we have hand washing stations throughout the hospital, and we ask your assistance in making sure that everyone who comes in contact with you uses the hand washing techniques. And then again, remember, please, it's our policy to call for help when getting out of bed. Other ways to help you stay comfortable, relaxation and deep breathing techniques are always wonderful. Sometimes just changing positions frequently, asking for extra pillows under your elbows are good, or behind your back. You will be using ice. There's an actual cryo cuff, which is a circulating ice for those of you who are having knee replacement. Hip replacements also will have ice packs, and you can also ask your nurse for suggestions. You will start preparing for discharge with your nurse in your inpatient room. Their job will be to review medications with you. They work as part of the team to provide you with excellent care. They'll talk to you about any new medications. Some of those may be pain medications, stool softeners, which are oftentimes used to treat the side effects of pain medications, and then blood thinners. And that will be dependent upon each of you and your surgeon. So there will be more discussion about how those will be implemented while you're here and before you go home. And you'll discuss common side effects with your nurse about all of these medications. Your rehabilitation schedule, your therapy schedule will be posted in your room on a whiteboard. You may have your first physical therapy session on the same day as your surgery. You may also walk with your nurse or get out of bed with your nurse before you have an actual visit from a rehabilitation therapist. But all of our nursing staff have been trained how to assist you. We have a care management team that is part of your overall care team. They are nurses who will assess your home needs. They will begin to work with you to formulate a discharge plan with input from rehabilitation, yourselves, and your surgeon. And any home therapies after discharge will be arranged by care managers. And it's important to check with your insurance regarding coverage. So what do you do if you have any questions after viewing this video today? Please feel free to call me, Janet Dyroff. I am the patient educator. My number is 207-662-6054, and you can email me at jdyroff@mmc.org. Please feel free to call or email with any further questions. We all look forward to caring for you here at Maine Medical.